Do you realize that we are down to 50s? This is the name of the sessions, in the 50s. So I would like to know first, is there anyone now in the 50s? Hopefully it's not against PDPA for you to show your age. So 50s mean who is aged between 50 to 59. You know, you have to be proud. So you are 50s to 59, just raise your hand up high. I didn't really see Ajahn Kanwa. More than that, oh my goodness, you look too young. So this session is really about the skin. I'm a dermatologist, so it's the pro-aging. Is there, again, anyone here know what is the meaning of pro-aging? No? Not much. So which means you have to pay attention because this is in. This is all my disclosures. It's all about the products and company that I used to work with clinical studies. And please do not take photograph or video recording of my patient. It's okay for take a photograph of me. I'm okay. So let's start doing why aging is important. So this is the progression, and this is the global trend of how people age. And look at here, this is the aging population. It's increasing 3% per year. It not look so much. But look, if you wait, like here, you will have by the years of 2050, you will have 2.1 billion. And by the year of 2100, I'm not living that long, but it would be 3.1 billion. So it's increasing. So that is why the business of the aging is progressing. And even the UN, so report world population, in the next 20 years will be 21% of the whole population, which means from now, the people who raised hand may be less than 10%. Before, I'm including, but in the next 20 years, people, 1/5 of the patient in this room will be above 50. We will look like this. Asia is going gray. Why? Because if you look at the proportion, Hong Kong, South Korea, Japan is expressed like, the highest top 3 of the people in Asia that age a lot. It's not mean looking age, it's not look old, but it's aging. People in this area, and then you see in 2022, comparing between Japan is the top 10. We know that Japan people age so well, right? They live that long, so that is why they age. But look at here in 2050, if you look at all the populations, you will see Hong Kong, South Korea, Japan, Taiwan is coming. Thai, we should be proud because we are number 6. I'll show you next in the statistics. And what happens when people age? It's good, because the alternative is dying. So, which means if you age, you live that long. But it's happened because it's shown on your skin. And you can't stop time. Since when you age, you can still reduce the sign of aging by improving your skin, by using anti-aging. And what is the meaning of the anti-aging? So which means aging and then you anti it. So it's the skin stimulating procedures and anything that you can slow down the process of aging. But do you know, as a dermatologist, if you want to change your skin to look younger, you have to go deeper to the dermo-epidermal junction. You can't really use anything only on the epidermis because it's just only the camouflage. If you want your skin quality to look better, it needs to penetrate deeper to dermo-epidermal junction. That is why the global anti-aging market is going up. And as I mentioned to you, the largest one is in North America, but the second one is actually APAC. And in APAC, we are increasing an in rate because of all the study population like Japan, Korea, Hong Kong, Thailand at number 6. We are down to the second global fastest growing market very, very soon. And what is the meaning of that market? market. So look at the number of all procedures, toxins, fillers, hair removal. I don't know, maybe removal of the gray hair would be something that we want to remove. But it's coming in, and the proportion of the procedures is increasing in 2030, so which is 7 years from now. Why I'm talking about that? So even though there is a people who want anti-aging, but there is now the wave about pro-aging. There is some people who there is nothing about anti-aging. They are happy, and ageless is the new anti-aging. I don't know what the word ageless, everyone age. But they tended to adapt and accept more of the wrinkles and lines. They think that these lines is a smile lines, it show happiness. This line is because I'm getting married, this line is because I got promotion, and the other lines is because I got proposed. So they keep the lines and make it as imprint. Is there anyone support this idea to keep your lines? To show how happy you are? Or put the lines at your life event? Not so convincing. So let's look at this. There is a lot of people that pro-aging and comparing between pro-aging and anti-aging. And pro-aging is maybe the new anti-aging. Will all the aesthetic doctors lose the job? I don't think so. Why? This is the real pro-aging. So pro-aging is the way you're accepting your real age. I'm 50, about to be 51. I'm really happy to be 50 as long as I look this good. But the goal of anti-aging or pro-aging is not to look younger, but feel better about how you age. And I think that might be the concept that aesthetic physicians like us should improvise. Because if you are riding along on the anti-aging market, it's not like you can change the patient's face from 50 to 20. But if you can have the patient who is 50 look a bit younger and feel happy at this stage of the age, I think that is something that we should looking onto. And Jamie Lee Curtis, everyone knows her, right? Especially if you are 50 or above, you know her. She's very beautiful back then. She's now gorgeous now. She said she is pro-aging. She wants to age with intelligence, grace, dignity, worth, and also energy. And she doesn't want to hide from it. You can see it from her face. She had a lot of marking lines. She didn't even hide it. It would be too much for me. Why? Because Ransima says, getting older is inevitable. But aging or look aging is optional. You can choose. Don't take my picture. Take my photograph. So for me, I think it's important to have twinkle in your wrinkle. You wrinkle, but it's twinkle. So let it make it shine. And I'll show you how. This is my way of doing pro-aging. First thing first, look at dynamic lines. Maybe you lightening it a bit with botulinum toxin. If you have volume depletion, fillers, the previous speaker, like the two handsome guy at 50 and above. I know Jisoo Kim is older than me. Dr. Hong, I'm not so sure, but by looking at his wrinkle, maybe a bit older. But of course, if there is the skin laxity, you can use also the energy-based device. Last but not least, skin texture is something that you need to look into, cosmeceuticals and lasers. But when you age, everything falls apart at the same time. So you need to mix and match. So you mix and match with your patient. When you have aging patient, you have to stage the plan. So look at this patient. This is one of my patients. And sometimes when the patient age, you can't really use one modality. You need to mix and match. For the first pictures and the second picture, not much different. Why? Because I just treat her only with toxin. And you can see that for people who already have static lines and volume depletion, botulinum toxins only is not do anything. But when you add in fillers, she look better. So that is the magic of combination. And how about people who even in 60s or 70s, she needs everything. In that pictures, it's 2 months after botulinum toxin fillers and energy-based device. I'm not telling any brands because it's my trade secret. If you want to look this good in your 70s, you know where to go. Siriraj Hospital, you know, 02-419-9922. Look at her on the side, and you can see it's not only overall improvement that looks good, but let me show you her skin quality at 70-something years old. She's still wrinkly, but look at her skin, it's tight, and the pore size is less. So which means this is everything all together. How about in male patient? I know that next session will be on male, so I just go ahead and talking about my male patient at 50. So he is 60-something years old, so he is a bit farther. And look at how he looked younger. But don't worry, he came to see me with his wife. Because at first, when a male patient coming to see me, I might have, a bad idea on why he want to look young. But he is together with his wife, so it's good. They get treatment together. And this is how we can improve. Of course, when you see the previous older lady at 70 years old, I can't really change her much, but I can just keep her look age and a bit younger. But when you start a bit sooner, at 60 years old, there is a lot that can be done. You can see different. There is the aging reduction gap. That is more. So which means, if you start at 50, you will look even better. And that is her. It's she, when she is 50-something years old, and now she look maybe 30-something, maybe 40. And you can see the quality of her skin is looking very good. So you can age. Again, get back to Rangsima's quote. Aging, getting older is inevitable. You get old every day, every time you take breathe in and breathe out. A second older now. And then, if you start doing something pro-aging to yourself or your patients, you get these difference and look. But of course, there's a lot of things coming. You have strategies. You need informed consent. You can't really just pull someone who is age in the middle of the road and say, look, you need pro-aging. You need consent from them. And most of the people in older generation, they don't need to look like, from here to there. They want something changed little by little. It's not like younger generation who want good-looking photo looking, or filtered shots. They don't need it. We just need something that is subtle change. So less is more, and sequential treatment plan. So which means you build a long-term relationship with your mature patients, and then you age together gracefully, not downhill. So I'll show you the sequential treatment plan. I already mentioned about combination of the treatment, but look at this lady. Do you imagine how old she is? Do you want to guess? Anyone guess the right question? You get Hujel from Putong on the back. I don't know if he's agreed. 34. You are mean. Maybe 30-something, but she look age, right? So that is why when the treatment, I know that this is younger than my topic, but she looked 50 to me. But she's younger than that. And this is what happened when we stage the treatment and get the treatment plan that is different. So I'll get her back to her age at 29. It's 5 years older. How about this lady? I already showed that she is 45. Does she look 45? No. It takes me 5 years from then to here. And then, she still be herself, aging gracefully, a bit younger or a bit more related to her age. From here to there is 5 years. How about treatment or prevention? Pro-aging is about something that you are doing in your happiness. If you're happy, you feel happy. There is a lot of things that you can do with botulinum toxin since we have Hujel here in the country, right? So botulinum toxin has two effects on the skin. Not only reduce the lines and inhibit muscle movement, but you can get fibroblast contraction and you can get rejuvenation effects. we published these studies, I think it's in 2019, years ago, about the effects of botulinum toxin in fibroblast contraction. And what we found in lactic botulinum toxin is at the concentration of 124 and 125. 124 and 125 mean in a vial containing 100 units of lactic botulinum toxin, you dilute it with 4 cc of normal saline or 5 cc of normal saline. And you can see that you can get the fibroblast contraction significantly starting at 1 hour after dropping it into fibroblasts. It's significant. How about at 1.125? If you drop 5 cc, you get immediately contraction. That is something that you can prove, that when you inject toxin at a good amount, at a good dilution, you get fibroblast contraction. And when fibroblasts get contract, it's produce more of the collagen. That might be the sparkling or twinkle in your wrinkle that you can make. It's not only reduce the wrinkles, but it can also produce collagen stimulation, which means after 3 months, even wrinkles come back. Your skin maybe get better quality. The study of identical twins, it's my inspiration. I know that I talk about this all the time, but I really love to talk about it. There's identical twin, twin A and twin B. The first one is someone who's taking a good care of herself. You don't get toxin, not that often. But the other one is someone who ignores herself, smoking a bit, and get toxins only 2 times in 7 years. This is the way they treated, the way she got treated. So eyebrows, corvid lines, forehead lines. And this is the difference after 7 years of taking care of herself and not taking care of herself. So if I were the first one who looked a bit more mature, and I see my sister or even my older or my younger sister looking like that, and this is identical twin, I might do something to change myself. But you know, some people never change. So another publication happens at 13 years afterwards. They're still doing what they are doing. You know, the good girls keep injecting toxin 2-3 times a year at reduced dose. The other girls still keep doing what she's doing, which is nothing. Again, she can reduce the dose because we didn't really need that much. I think that might be because of the fibroblast contraction, and then they get better quality of the skin. So we need less amount of toxins on the wrinkles. And this is what happens. Breathe in, breathe out. And think about when you are 50, how you want to look like. And people might think that the photo is because we take a photograph while toxin is still kicking in. And you can see that the one who keep injecting toxin, this is the picture that we're taking when it's all wear off. She can have wrinkle even more at her smile lines. If I can recommend her just one thing, I'm telling her to inject more fillers. Or maybe get skin booster around here. It will look even better. So prevention or treatment, it's your choice. Prevention for me is far better. But of course, as the aesthetic, and we are also doctor. Remember, doctor. You need to think like, you know, the pro-aging is not like we obsess about looking young. It's actually not, I don't want to look 30. I'm 50, I want to look maybe 40, 45, it's good. Just 5-10 years younger than my age is enough. I don't want to look 20. But of course, like, you know, when you try to push it too much, you have to think that are we like obsessed on how looking young? No. Because if we think that we need to look so young, it will be a pressure on the woman and everyone to look youthful. Don't forget of your inner and inside. Should we start preventing this girl? How about this one? 18? Maybe not. 24? No photograph? But maybe yes, at her 37 years old. If she do nothing, how would she look? But if she do something, she decided to take executive decision that I need to change, I want to look good, and I want to feel good. She can change. In 7 years, let me move on quick, and she got married. Finally! Less is more. Don't do things too much. You still be you. I don't want to look like Champu Arya, or I don't want to look like Pacharapa. I want to be me, happy me. But while doing in this business and keep doing things, treating yourself and treating your patient, have you ever wondered what will happen when you stop treatment? Have you? Have you? Have you? I'll show you what happened when you stop treatment. This is the examples of my patient who get the treatment at 2 years after stop treatment. And you can see that she aged a bit, but she is still looking good comparing to before. This is at 70 years old. But how about the one who started treatment younger? Remember this guy? And this is 2 years after doing nothing. Not so bad, right? Even get just only once or twice regular treatment for a period of time. I'm not deciding to stop treatment. This soon, I will tell you maybe next time, but not now. Last but not least, what I would like to tell you is the true success is actually not in the learning like today, but it's in the application to the benefit of the mankind, from Prince Mahidol, who is the father of modern medicine of Thailand. Because while we learning how to make people look more beautiful, more happy, there is also still a diseased people who suffer. Like this one. She is aged. She didn't really care how good she looked, but she has facial asymmetry. Every time she has expressed her feelings, everyone laughs at her. This is how we can change. Think about that too. Another lady suffer from stroke, and at the end up with facial asymmetry. Use your skill, use your magic. Because this is also one and maybe the best pro-aging treatment that we can do. In conclusion, I think pro-aging is not just only look younger. You need to feel better and be the best version of yourself. And you can achieve it through combination of treatment, toxins, fillers, and sometimes energy-based device. Let me end up with this. Since the Asia is aging, do you know Michelle Yeoh? Everyone knows her, right? If you're old enough. She's in my age. Actually, she's 60. And this is her. She won the Oscar 2023. And I would like to end with her quoting. Can we press and run the video? Can we turn on the sounds? This is her speech at the Oscar Award.
Thank you. Thank you. For all the little boys and girls who look like me watching tonight, this is a beacon of hope and possibilities. This is proof that dreams dream big and dreams do come true. And ladies, don't let anybody tell you you are ever past your prime. Never give up.
Don't let anybody tell you that you are too old to do things or accomplish. Last but not least, if you want to learn more about pro-aging and listen to me, Ho Sung Choi, Jisoo Kim talk at 10i class, Bangkok at the end of this month. Still have time to get registration. Thank you.